Hi, this is Paul Wright, the Behavioral Health Program Manager at Tri-County Health Network, and I am joined today by my colleague, Corinne Cavender, our Behavioral Health Operations Coordinator. And welcome to another edition of Mental Health Matters Access Show here on Kodo. We are hosting these shows on the third Wednesday of every month on Kodo to highlight resources and programs that are available in our community around mental health. Interviews will be posted to our website at TCHNetwork.org following the broadcast. And we're excited to have you join us today. So thank you to the Kodo News Department and Ben Kerr here at Kodo for making this possible. Corinne, who's our interview with today?
For this segment of Mental Health Matters, we're joined by Lindsay Wright from the Telluride Regional Medical Center. Thanks for being here, Lindsay.
Thanks for having me.
So first, will you tell us a little bit about yourself, your position, how long you've worked for TRMC, education, anything you think you want the community to know?
Sure. So I'm Lindsay Wright. I'm a licensed marriage and family therapist, and I work at the Telluride Regional Medical Center and have for a little over 2 years. Prior to that, I worked at the Center for Mental Health for around a year, and before that, I worked for a nonprofit in Vancouver, Washington, which is more or less a suburb of Portland, although they maybe wouldn't want to be known as that. I worked there for, I think, somewhere between 4 or 5 years. I also did my internship there at a nonprofit called the Children's Center, primarily working with kids who had experienced sexual trauma. So, yeah.
So the reason we have you here today is to learn more about the behavioral health services that are offered at the Telluride Regional Medical Center. Can you explain what offerings you guys have for the community?
Yes, and they're a little bit different right now than they would be in non-COVID times. But there are 2 behavioral health counselors on staff, myself and then Ray Schaffner. And we kind of just split our time doing 2 different things pretty much. Every day, one of us is working with the doctors in kind of an integrated care model. So if anyone comes in to see their primary care physician and they, screen in with maybe some higher numbers on something like the PHQ-9 or the GAD-7, they have the option to talk with us if they would like. And that visit can look like teaching some coping skills or just listening to somebody about what they're going through. It can be connecting them to different services like Tri-County or Center for Mental Health, or to a private practice therapist, or to AA, or suggesting the Good Neighbor Fund. Those sessions really depend just on the person's individual need. And then on the days that we aren't doing that, Ray and I both hold a pretty small caseloads of individual clients. In non-COVID times, when it's safe to gather together, both of us tend to run kind of our own separate groups as well. So we'll hopefully bring those back when it's safe to gather together again.
Great, thank you. Thank you. You had mentioned a couple of acronyms, and I'm not sure everybody knows about, and I'm less focused on those, but around the screening. So anyone who comes into the primary care clinic gets a screening for, is it for depression or suicide or anxiety? And then do you also screen people who come into the ER? I'm just curious.
Yeah, good question about the ER. I am not exactly sure of their practices on that side of things because I'm primarily in primary care. That said, if they do have someone who would like to speak with a behavioral health consultant, Ray or I definitely will go over there and help, but we primarily are in primary care, which typically, and I hope none of the nurses are like, that's not true when they listen to this, but typically they ask 2 questions as an initial screening. Just, I think that's the PHQ, which is more of a depression screening, and then at larger visits, or if it's just someone that we know might appreciate checking in about mental health, they'll get kind of that depression screening that has multiple questions, along with the anxiety screening that has multiple questions. And no one's obligated to do anything regardless of, what their screenings are. They don't have to talk to us, but they should be offered that in that moment. And then, yeah, they can speak with somebody.
Gotcha. So it sounds like if I wanted to access your services, I mean, you'd mentioned you see some individuals, you know, in a more of a ongoing therapeutic relationship, but if I wanted to access either you or Ray's services, that I go to see my regular doctor first, or I make an appointment at the med center specifically for mental health, or do I go through my primary care doctor?
So you're right, you'd go through your primary care doctor. So if your primary care doctor was Dr. Mahoney, the appointment would be on Dr. Mahoney's schedule. And that's kind of nice because then you get to see your primary care doctor. So if you had any interest in talking about how maybe medication could also help you cope with whatever's going on, or nutrition, or is there a medication that could help you, or supplement that could help you with sleeping a bit better, it's kind of nice because then they can answer those questions at that visit as well. And I personally like it because I think it creates more of a team approach. So you're not just seeing this one person over here, this one person over here. You know that you have a team of people working for you.
Right. So does that look like, I know you kind of mentioned this before, but like going into an appointment with a primary care physician, or can you kind of tell us what a day-to-day might be with that integrated model?
Yeah, so my day normally starts just kind of looking through the schedule, seeing who all is on the different providers' schedules, and then kind of, we call it a huddle when we, myself or Ray, whoever's day it is, to be with the doctors, we meet up with the different providers and kind of see who they think we might need to meet with that day. And some people, there's a very clear heads up that they've said that's the reason they want to come in. They said, well, I want to follow up with Laura Cattell and Lindsay Wright. Okay, that's pretty obvious why you're coming in. You know, there might also be some folks that's like, oh, that's a potential person. They're coming to discuss anxiety. Maybe they're just coming to talk about medication and they won't really want to talk to me, but it's good to just kind of know. And then just kind of as the day goes, just kind of meeting with those people. And sometimes there's surprises, you know, sometimes someone comes in to discuss like a rash on their arm, and then they end up talking with their primary care physician and it comes out that they're going through a really stressful life event, and then I can come in and chat with them a bit there too. So it's from my perspective, I think it's a pretty cool job because it's always a little bit different from day to day.
And then since you are kind of tag teaming with primary care, how do patients go about paying for treatment? Does the med center take insurance or Medicaid or Medicare?
The med center does take all of those things. I'm a little bit tricky for if anyone's seen me for those individual sessions. That's billed through me, not through the primary care provider. And fun fact, licensed marriage and family therapists cannot take Medicare. So I can't take that one individually, but if it's in tandem with that primary care appointment, anything goes insurance wise. Yeah.
Great. And then you kind of mentioned some of the other programs that happen in non-COVID times, but how do you think in general the programs that you and Ray run and just the Med Center in general in regards to behavioral health help the behavioral health in our community?
Yeah, I mean, I'm obviously a little bit biased, but I do think that we do provide a pretty good service to the community because I think sometimes, you know, if you're in here, again, you're coming in for a rash and then you're discussing a family problem or how you've noticed you've been coping with alcohol or that you're not sleeping very well. I feel like sometimes you can catch things earlier before it builds up to a bigger issue. So I think it's just really that we're starting conversations earlier. I know there'll even be some instances where, you know, one of the providers will say, you know, I want you to meet with Lindsay or I want you to meet with Ray today because I just want you to know that they're here to support kind of your more mental health needs, whereas I'm here to support your physical health needs, just to kind of start that relationship. I feel like that's a conversation I have with teens a lot who maybe in that moment are like, cool, who are you? I don't really want to talk to you. But then they know down the line, okay, like, who is that lady? I guess I could go and talk to her. She seemed okay.
Does it seem like with that sort of model that it's kind of creating a less stigmatized view of mental health, like it's more in tandem with your physical health? Are you seeing that kind of reaction from community members?
I would say yes. I mean, I think because there are some things that really have a cross over that we end up discussing with patients, like chronic pain management, tying in the mental health aspect of that, and even acknowledging that it's there, that like there is a connection between kind of your thought processes and pain and kind of how they can tie together, I think is a really good example of that. And I think just normalizing it, like, okay, you're here for your physical, okay, like, I don't know all the things they do at a physical, but like this looks good, that looks good. How about your mental health? Just adding that in as a service, I think is good, because I mean, our minds are not really separate from our bodies.
Absolutely.
Yeah. So I hesitate to call them normal times because it's been a long time. I'm not sure what normal is anymore, but I mean, what behavioral health problems are common in our communities, and how has it changed, if at all, that you've seen, since last March?
Yeah, I think my perspective would be that, issues that were in our community before have just really been amplified throughout the pandemic. I think typically Telluride or San Miguel County, mountain towns in general, mountainous regions, rural regions in general, tend to see anxiety, depression, substance use. And I think all of those things have continued to be here. I think this year I've met more people than in years past that maybe have come in and said, I'm feeling this way and I've never felt this way before in regards to anxiety or depression. It seems like there's been more relational issues, and maybe that's just the lens that I see things through, given my training and my licensure, but it does seem like, being quarantined with your family causes more conflicts, or, not being able to see people that are further away creates loneliness. So I think those relational issues have been pretty big, and then just kind of maladaptive coping skills like increased substance use.
Mm-hmm. Mm-hmm. So you mentioned, I mean, you've seen an uptick, I guess, then in terms of the number of people accessing these services since last March.
And I haven't run the numbers on that, so I can't say with any definite numbers, but I do feel like there have been periods of time where it's felt rather busy, or where situations have maybe just seemed more intense, or it's people that have just never sought out services before, which that part's really encouraging, that people have been able to recognize, like, okay, I've never felt this way, it's time to do something about it, and get some guidance on what that might be.
Mm-hmm. Great, thank you.
And then we have a couple more minutes, Lindsay. Do you want to explain anything else you want people to know about you, or about TRMC services, or about you and what you do?
Ooh. Well, I guess one thing I didn't mention that I've really enjoyed doing throughout the pandemic times is, I don't know if you guys get these, but a lot of our patients at the Med Center are attached to our email blast system. And I've really enjoyed writing, it's a newer task for me, but I've liked it a lot, writing, they're called medical moments, but I'm doing specifically ones related to mental health, and doing little recordings. Sometimes there's like a visualization or some sort of coping skill. Sometimes they're a little bit more educational, and that's been kind of a newer facet of my role that I've enjoyed. And I know that I've felt really grateful that I've gotten a lot of positive feedback about that. I'll meet with a new patient sometimes and they'll be like, oh, I know you because you create those recordings. And so I think those are just a good thing to let people know that they exist. They're free, they're just on our website. And there's just a bunch of different coping resources there, and little bite-sized nuggets. I think the audio clips are no more than like 5 minutes. So, I think that's a quick thing that can be offered to somebody if they're, hey, I'm having a hard time sleeping. Well, there's actually a medical moment that talks about that. If they're unable to come in and talk about something, or if it's just to a friend, like, it's a good quick resource that has come about.
Right. I'm glad you mentioned that. We at Tri-County, we love those writings by you and recordings by you. So we definitely encourage our community members to go check those out. So Well, I think that's all we have time for today. So thank you so much for joining us, Lindsay. And if anyone's interested in behavioral health services through Telluride Regional Medical Center or other providers in San Miguel County, the San Miguel Behavioral Health Solutions Panel has funds available. So to learn more, visit sanmiguelbehavioralhealth.org. And then Lindsay, if people want to reach out to you, what's a good contact?
I would just say the main number at the Med Center, 970-728-3848.
And then join us March 17th for our next edition of Mental Health Matters. If you are interested in learning more about our behavioral health programs at Tri-County Health Network, please email us at info@tchnetwork.org or call our offices at 970-708-7096.